What is a chiropractor? A chiropractor is a neuromuscular skeletal physician that kind of focuses on the spine, the spinal alignment, tissues surrounding the spine, and the way the spine is moving. So when the spine's not moving correctly, that can cause some nerve interference and pinch some nerves. So what we do as chiropractors is kind of focus on getting the spine moving correctly and remove those interferences. What is chiropractic care? How does it work? And what are kind of the common methods we use here in the office? So that's a really tricky question to answer because chiropractic is very vast and the different techniques and methods different chiropractors use. Here at Swan Lake, we kind of focus on diversified, which is high velocity, low amplitude adjusting with our hands. We also use activator method, which is a little clicking machine that's a little less intense for our more acute patients. And then we also use Thompson drop, it's called, and SOT methods. So as you can see, there's a lot of different methods, but as chiropractors, we look at your case individually and determine which one would be the best for you. Are chiropractors doctors? The degree of chiropractic is a doctorate degree. You'll hear a lot of chiropractors address themselves as doctor. Does that mean we are medical doctors? No, our training is very different and we should not be looked at the same as a medical doctor, and you should not go to us for the advice you want to go to them for. Is chiropractic a new concept? No, chiropractic has actually been around since the late 1800s, and then it kind of got developed in the early 1900s. And to be honest, it's one of the few healthcare fields that has kind of stayed similar through the concept. Do adjustments hurt? More often than not, no. Adjustments are very safe, very gentle. Sometimes when we get patients in that are really inflamed in an acute stage, they just fell shoveling their driveway or something like that, then it can be a little tender to the touch, but as doctors and providers here, we try to tailor our adjustments to make them as least painful as possible. Are adjustments safe? Yes, the sounds and the cracking and the things you see on the internet might look a little scary, but chiropractic adjustments are very, very safe and very, very rarely do any complications happen. Are all patients adjusted the same way? No. This is another thing that we do here in the office. We think clinically. After we feel the spine, we feel the tissue, we do our exam, we kind of determine which method would work for each patient. And then our second visit, if it doesn't go as we planned, we can modify that method. So no, not all patients are adjusted. Can I learn to adjust myself? This is a question I get a lot. No, you cannot. So you might be able to move your neck around, move your back around, and hear those popping joints, or popping noises. But the popping noises do not mean you're moving the correct joints. That noise is just gas moving around within the joint. As chiropractors, we find the specific joints that are restricted or subluxated, as we call, and we move those joints with very great specificity and speed. So that's the difference between trying to adjust yourself and having a chiropractor do it.
Chiropractic is great, and so are you.